The common realm of where patients go when they first present with, heavy menstrual bleeding is your gynecologist. They have a good rapport with them. And, there are multiple ways to treat fibroids, and they all have their pros and cons to those conditions. I'm very specialized in what I do with the uterine fibroid embolization technique. But I think it just comes around to education and having good conversations with your gynecologist. So, there's guidelines, and there is, talking to your gynecologist, knowing, am I a candidate for hysterectomy, myomectomy? There's even less invasive, laparoscopic, hysteroscopic myomectomy. There's now even more techniques where they can do radiofrequency ablation, the sonatas, the accessas, and then there's, uterine artery embolization. And so I just think in general, hysterectomy has been around forever. It is the most common gynecologic surgery done. Most commonly, it is done for benign disease for fibroids in the US. I think when it comes down, I don't know why specifically that is always presented first, but if the uterus is gone, you can no longer have any more problems unless you're like Ashley, something really rare. But if the uterus is gone, the fibroids are gone, you're no longer going to have any more problems with uterine fibroids. Versus these other techniques, you still have a uterus, there's a possibility of having fibroids recur, new fibroids grow. So it really comes down to, patient expectations, size, number, location of fibroids, and then talking about at length all of those different treatment options, and then letting patients kind of navigate, what are the pros and cons of each and how that'll best go for what desires they have.